Thank you very much, Jocelyn, for joining me for Talking Teeth Thursday. We're going to have a chat about cancer care and care for patients who have cancer and how that impacts their oral health. And Jocelyn is our expert and has basically influenced everybody's focus on looking after patients who have cancer, not just head and neck cancer, mouth cancer, but right across the board. So we're really glad that you've come back and joined us again for this, Jocelyn. So thank you very much for that. So just thinking about the oral impacts of cancer care, what potential damage can occur while I'm having cancer treatment? What kind of impact on my mouth, or do I need to know anything in particular beforehand?
Well, thank you very much for inviting me back. It's a real honour to be invited back and to share a little bit more knowledge and how to help our patients. So there's various things that can happen to the mouth during treatment, same as it does without treatment, gum disease and tooth decay. But because of the way that cancer treatment works, and it can dry your mouth out, or the way that you're eating and regularity of what you're eating and potentially drinking. So you might have been really good at eating 3 meals a day and no snacks before, but during treatment you may well be hungry, or you can't manage a big meal, so then you're eating more sort of little frequent meals, and so this raises your risk for tooth decay. You potentially get dry mouth. A lot of the chemotherapies and radiotherapies affect the mouth, especially head and neck for radiotherapy, but chemotherapy for any part of the body that's being treated can affect the mouth. This can dry your mouth. You may have been on medications before you started treatment, so your mouth may have been a bit dry before treatment anyway, and then it's going to get that bit drier. Other things that can happen is you might potentially have oral mucositis, where you have inflammation of the inside of the mouth, and that can get incredibly sore. And whilst it's sore, you might not want to brush your teeth. So this raises your risk for tooth decay and gum disease. You might have ulcers that might be tiny, might be big, might be resolving gradually, or might be hanging around, or you might have a crop of them. All these things can get in your way during treatment of keeping your mouth healthy. And this can affect nutrition, the way you speak, the way you eat, lots of different things that can affect you all over, but it's your mouth, and people often don't think about this until they're in treatment or further into treatment, and then they realize they're getting these side effects and they want some help and support. Yeah.
So would you recommend people see their dental team before they start cancer treatments?
Absolutely. The training that we've done at the practice that I work at is that we had a round table and I gave them a presentation. So when the patient rings up to either cancel an appointment because they've just had a diagnosis, or they've had a diagnosis and they want to find out if they can be seen, absolutely, we get them in. Even if there's no slot in the book, I will get them in for a chat, just to kind of pre-warn them a little bit about potential troubles. They might not get any side effects, but they may do, and it's to sort of help them with thinking, okay, this is expected, this is what I can do, and then give them lots of hints and tips. So absolutely, an appointment with a dental professional before they start their journey would be fantastic.
And would they expect at that point to have any treatment? Would they expect the hygienist to maybe clean their teeth, or would there be anything specific, if they have teeth that have been problematic in the sort of year or something? Are there any sort of treatment expectations really when they go for that dental appointment before they start cancer treatment?
Well, hopefully. I mean, it all depends on timing. Sometimes you just don't have enough time. They have their diagnosis, they're literally going to be going straight into treatment. There might not be any time other than giving oral hygiene instructions to tell them what toothbrush to use, what toothpaste to use, possible side effects. They might be having a problem with the tooth, that the dentist will have to need to speak to oncology to see if that tooth can be treated or extracted. There's lots of things that need to be weighed up so that it doesn't affect the patient during treatment, or can it be postponed until after their treatment? Or if they're going to be on long-term chemo or long-term treatment, where in the cycles can they see the professionals? So there's lots of things to discuss, but they need to come, or at least have a chat with somebody on the phone at the very least.
That's brilliant. Really, really good to know. I think so many people don't realize the oral general health connection, and also the oral treatment and medical treatment and how those interact. And I know you've done a lot of work with other professionals to get everybody singing off the same hymn sheet, which is so important. So, keep doing that bit of what you're doing. I was going to ask you, I mean, many people ask, should they use an electric toothbrush, or can they use an electric toothbrush during cancer treatments?
So if you're using your electric toothbrush really well, it's well charged up, changing the heads regularly, and your oral hygiene is good, I personally would say to carry on, unless your mouth gets very sore and then you move to a manual toothbrush, maybe to a baby toothbrush, just depending how sore the mouth is. They may be advised by the oncology staff to stop using the electric toothbrush. Do what they say. I personally, if your oral health is good and your level of plaque control is good, I would say continue. But obviously speak to the professionals about that. Yeah, mouth clean as much as possible.
Do you find that the medical professionals actually know an awful lot about oral health and oral health promotion and the oral health messages?
I think it's an area that needs a lot more collaboration. We need to think more holistically, because these patients come back to us after treatment. I have had patients come to me during treatment and I can't touch them. But if they've been given that advice to come back at the right time of their treatment, it would have saved a trip when they were particularly tired or fatigued or, you know, a bit stressed. It would be nice to be able to have that bit of continuation, because we want the patients to come back to us at the right time. And I think, yes, we need more education for the medical professionals so they know all about the mouth and it's not such a non-entity. You know, is all connected.
It is very much so. Well, you know, my feelings on that totally. What about cleaning in between your teeth? I mean, flossing, interdental brushes, is that something that you would recommend anybody that is undergoing cancer treatment or even is getting prepared to undergo cancer treatment?
So I have a few patients who've had a diagnosis. They come and see me and I really sort of say, right, now's the time to get your mouth as healthy as possible. They may well be advised to stop cleaning between the teeth. There's papers out there, I believe, that say to stop using something between the teeth. But I think if you've got a good level of oral health, it can only keep you better and healthier for longer through the treatment, because it can affect the treatments and potentially even stop your treatments if your mouth is poorly. So I would say be guided by your oncology staff, but also think about your oral health as it is before you start. So the better it is, the better.
Yeah, so if they're in good shape to start with, they can continue in that. I mean, why would the oncologist say don't clean between your teeth? What would be the problem of doing that? What's the potential downside?
Well, sometimes it can affect your blood count. So it's about keeping everything as stable as possible. And they take the bloods regularly. So they check what your bloods are doing. And it's about keeping you healthy at a level. But unfortunately, if things get destabilized, it can really affect you during treatment. So it's about keeping the status quo. I think when I've asked medical professionals, why do they recommend to stop using it? They say because their gums bleed. And so I say to them, do their gums bleed to start with before they start treatment? Do your gums bleed, actually? You know, and we have this discussion, so I make it quite personal. And then they kind of understand what I'm talking about, because it's about gingivitis, periodontitis, about keeping the bacteria under control. Yeah. And gums may bleed, as you know, and it's a warning sign that they're not healthy. It's not normal, you know. And so we need to have more education for the medical professionals to understand that.
Yeah, it's that potential for bacteremia and bacteria to get into the blood system, the system.
Absolutely.
That's the real problem with it. Yeah, and I totally agree with you. I think it's that thing, you know, is where's your starting point? And I mean, every time we brush our teeth or clean between, many people will create a bacteremia anyway. You know, it's a matter of not making that any worse.
Yes, absolutely.
Making it better, particularly with the mucositis thing. I mean, that can be so unpleasant. What would you recommend for anybody who is experiencing a really sore mouth? So, say I have I'm undergoing chemo radiotherapy and my mouth is breaking down. I've got lots and lots of ulcers, and I ring you and say, "Is there anything I can do? I can't bear a toothbrush near my mouth."
So often they'll recommend initially ice chips. So ice chips are cooling, they sort of help with the inflammation. Then they may prescribe products like Cafesol, Gelclair. These are ones that a lot of ward staff will give you on the wards. And then there's lots of other products that you can be prescribed or you can buy over the counter. So they will line the mouth, sort of help with that, or they may help with sort of an anesthetic feel. So Difflam is a common one that's recommended. Sometimes it's a bit stingy, sometimes it is absolutely fine. So sometimes it's a bit of judging what's right for you. There's lots and lots of products out there, and obviously lots on your website too to help our patients. So a lot of help there. Sometimes they've got to get through it. If their oral mucositis is very, very bad, they will be put on some very strong painkillers, and that will be prescribed by the oncology staff. So it depends on the level of oral mucositis. So it's graded from 1 to 4, and it obviously depends on where they are on the scale. 1 is better, 4 is not great. And that's where the oncology staff will be checking the mouth, and they will then see what they need to prescribe to sort of help, and see if it's long term, and how much they need to prescribe to help.
Yeah, and it's about the priorities, isn't it? Because you've got to get this person better as a whole. And I mean, if their mouth is sore, they may not be able to eat, and that has a nutritional impact, and then that has a knock-on effect. So all these things do interlink, don't they? And I must actually tell you about a product we've just started bringing in, and this is totally digressing. I'll probably cut this out, Jules. But renewing melts, you know, the xylem melts. This is there. I'm trying to get this without.
Oh, cool.
Hyaluronic acid.
Oh, I like that.
Slow release. So it's the same discs that you have with xylem melts, but they're for literally sores, cuts, ulcers, and sore mouth. And actually, I mean, I have 2 or 3 test people, guinea pigs, bless them, who will give it a whirl. And these, I mean, I brought them directly because the distributor for xylem melts won't bring anything except xylem melts in, so I just have circumnavigated and gone straight to the manufacturers in the US.
Right, okay.
Because I mean, I have a lot of people really like the xylem gel combination. Dentacare weren't keeping that anymore, so I went and got it direct. But anyway, back to where we were meant to be.
Okay, no, that's great.
It was just what was in my head. I thought I must tell her about those, because I lifted them up and thinking I must tell her about that.
Yeah, right. Thank you.
Right, okay. Where did we got to? We were talking, oh yes, about the medics and gum health. I mean, is there a particular toothpaste that is good to use during cancer treatment?
So what often happens is that the diet is uncontrolled, lots of sugars, lots of acids to get through the treatments. You know, as dental professionals, we like patients to eat maybe 2 or 3 meals a day, and if they eat their snacks between meals, then to make sure they're sugar-free and tooth-friendly. However, during treatment, that can go completely out the window, and patients lose a lot of weight. So actually, you need them to be eating a lot of food frequently. So the Delivering Better Oral Health Guidelines, so our dental Bible recommends a high prescription fluoride toothpaste. So it's Colgate Durafat toothpaste, and that is recommended for different age groups because of the percentage of fluoride that's in there. So that is my go-to. That's what I prescribe for all patients, and that's what they go away with, whatever cancer treatment they're having, just in case, because there's nothing worse than going through treatment and thinking, gosh, if only we'd done this something, you know, it could have helped them, you know. So that's our go-to. There are lots of options. Some patients don't get on with mint. They don't necessarily get on with the foaming agents, so sodium lauryl sulfate. It might be something that they don't like. So there's loads and loads of other alternative toothpaste that haven't got SLS in, aren't minty, have got enzymes in, they've got loads of different products in. It's just amazing. So it's a bit of trial and error, really, as you know.
And it is, I mean, cancer is such a personal journey anyway. So it makes sense that the treatment and the care is also going to have to be very tailored. And it's great that some of the manufacturers actually now do little trial sizes, which
I love them.
Brilliant, that they can try it out and work out what's right for them, which is great. Yeah, I mean, would Durafat, the Durafat toothpaste, the really high fluoride prescription only fluoride toothpaste, are those for long or short-term use?
It depends. So a lot of patients who are short-term treatment, yes, they can start it at the beginning of the treatment and finish it when they finish the treatment. Some patients will be on long-term treatment for the rest of their lives, you know, and so we have to see them regularly as dental professionals, see if there's anything we can help them with. It might be fluoride varnish we need to help with as well. So yeah, long-term use, absolutely fine, not a problem at all.
And that's obviously still always going back to the risk that they have at that time.
Very patient specific.
Yeah, and
it's tailored.
Yeah, in context of the other risk factors that are there. Yeah, because some patients will have lifetime dry mouth.
Absolutely.
The major problem for all sorts of oral conditions, whether it's trauma or tooth decay, gum disease, even tooth wear. Yeah, I mean, it's such a personalized thing, you know, which is why we're so fond of getting people on the end of a camera like this and chatting via Zoom, which has been great. So that's fantastic. I mean, it does having cancer change. I mean, say I've had cancer, I've had my treatment, and I want to go back and maybe have some cosmetic dental treatment, or getting my teeth whitened. It's the loss of hair. You're suddenly want to be normal. You want to get back to feeling right. Does having cancer have any impact on sort of the long-term types of dental treatment that I can have?
I don't believe it does. I'm happy to be corrected, but I don't believe it does. And I think you have to balance some things up. And obviously the health of the mouth is priority. So if there's fillings to be done, or crown or bridge work or dentures or something like that needs to be done, then absolutely. And if the patient feels they want whitening, then I can't see that being a problem personally. Because if that makes them feel better for however long we're on this planet for, then go for it. Done by a professional, speak about it with the professional, and I don't think it's a problem at all.
No, I think that's brilliant. Is there anything else that you think would be really useful for people to know? I tend to think, you were saying about people's diet changing, and often there's a big weight loss, and then you have to try and get calories in, and they use a lot of calorie dense products to sit over prolonged periods of the day. Is there anything, about those that we need to be aware of? Is there anything that we can counteract?
Well, they're high in sugar. They're meant to be. They've got stacks of calories in them, lots of good things in them. But yes, you're coating your teeth with sugar the whole time you're having them. So high fluoride toothpaste, xylitol. Xylitol's fantastic in mint form. There's loads of different things that can just help to rebalance the mouth. Good toothbrushing. Just keeping everything as healthy as possible, really, and going to see the dental professional regularly. And it might be that you're seeing them more regularly than you did before. And if you're on long-term chemo, finding out when it's appropriate to see them with that cycle. So that's what I would recommend.
Would you often recommend mouth rinses?
So mouth rinse is used at a different time of day to toothpaste is wonderful and absolutely not a problem at all. Just make sure they haven't got alcohol in them, make sure they've got fluoride in them. Anytime you want to rinse around, maybe to freshen, maybe if you're nauseous, maybe you've been vomiting, not to brush your teeth, but use the mouthwash to help to just freshen your mouth and make you feel a bit better. Absolutely. You have to sort of change your routine, but with keeping your mouth as healthy as possible with the least amount of damage as possible to get you around the other side.
We find tweaking things, as I always say, a risk assessment is not for life, it's just for that point in time. And when you view somebody's mouth in the context that you see them clinically, all you can say is this is how things look now, but that will change. And somebody that is undergoing cancer treatment is going to find that their risk changes, that they maybe, as you say, need to see the hygienist more frequently or the dentist more frequently, have things adjusted as they go along, and then that will continue. Always going back to that bespoke sort of personalized oral health advice. And we find that what we're doing now, we're just trying to make it automatic because it works at the minute, that people who would see their clinicians would see us via Zoom, so they would do the virtual coaching and book 3 or 4, and we do them maybe every couple of months, and then we can work with the dental team. So we let the practice know that they're saying us, because they don't physically need to be in the dental chair, but they do need a little bit of moral support and little minor tweaking and just updating the risk assessment, which is actually in many ways a lot more convenient for the cancer patient because they can do it from home. We can feed that back to the dental team.
Oh, lovely.
So there's that integral sort of working together, which has been great. In some way that has worked for us. And I actually have had a couple of people that I have seen with my clinical hat on for years. This will make you laugh, Jocelyn. And I have, during the first lockdown, we started doing Zoom calls with them. And that was fine. So they were booking time out for teeth. They were giving me more information than I ever got when they were in the dental chair.
Oh, lovely.
And we were sitting like this. They were sitting in their own home. We were having a great old chinwag. And you could just see a light bulb switch on. And I'm going, I've been saying that for years.
Yeah.
And it's down to I'm quite sure it's down to them not being in that clinical environment, that they find that actually I'm quite comfortable here. I'm not worrying what she's going to do with those things. It's really interesting, you know, and it's great that we can work with dental professionals like yourself and many other practices to support what you're doing. You know.
Yeah, absolutely.
So
It's different platforms, isn't it? Different ways of working now, and I think it's great. Any way that we can help, it's
yeah,
just perfect.
and you're very much like me. I think you'll talk teeth anywhere, anywhy, anyhow.
Absolutely.
Just give me the opportunity and I'm off. And yeah, but I think it's I think clinicians are becoming more comfortable with this type of interaction beforehand. So, you know, anybody that is undergoing cancer therapy, I mean, I do think it's important that they touch base with their practice. And the chances are they may well get a call back or offered a Zoom call, and then they can actually get the ball rolling without physically maybe having to make a long journey, or, you know, when they're knackered and very stressed to begin with.
Absolutely.
And it makes it easier.
Anything that makes it easier. Fatigue is a big thing with cancer treatment. A lot of people think, you know, they might be go-getters at the beginning, you know, they've always been, right, I'm doing this during the day, I'm doing that during the day. And actually during cancer treatment, you really can suffer with fatigue. So have you heard of the spoons theory?
Oh, I know your spoon, but please share it because I love your spoon.
Oh, it's something I learned at a Macmillan meeting, which I talk about all the time now because I think it just struck a chord with me. So it was a lady who had a chronic lupus condition. So she was describing her condition to her friend when they were in a restaurant one day, because her friend was saying, what's it like to have lupus? And she said, well, you know, it's like, you've been to my appointments and things. She said, no, what's it really like? So what she did, she went around all of the restaurant tables and collected up all the spoons. And she sat there and described what I'm going to describe to you now. So when you get up and you go to work, you don't just get up and go to work. What you do is you get up, you go to the bathroom, you wash your hair, brush your teeth, get dressed, after you shower, you know, everything you do, every activity uses a spoon. And you might have had hundreds of spoons before you had cancer treatment, but now you have 30 and you've got to leave one spare for the following day and you can't borrow any. And it makes you really think. So you might have used up quite a majority of your spoons just getting ready in the morning. And so it makes you really stop, slow down, and just think about those spoons. So the spoon theory, it's all over Google. You can YouTube it, you know, it's really interesting. And it just makes people go, okay, well, this is how I feel. This is what I'm supposed to be feeling. And actually, I can't make that appointment. I'm really sorry, I can't make the appointment. And it just doesn't make them feel bad. It's just them coping. And it's really important that fatigue is understood. So I love telling everybody about the spoons theory. So yeah, fatigue, it's important to look after. But then as you come through treatment, you might have a little bit more energy. So then you've got to weigh it up, you know, you don't want everybody doing things for you. You can actually go and do something for yourself or do something for somebody else. Or the other thing is also, men don't often like to go out walking on their own. So what the other tip that came up from the same meeting was to carry a newspaper or carrying an envelope with a stamp on, say, and you look like you're going somewhere, you have a mission. And so you can go for that walk and you're not too worried about people looking at you, although people aren't really looking at you. It's just your own interpretation of what you think people are thinking. So it's making sure that you keep fit, keep active, doing something, but then weighing it up with your fatigue so that you can last and keep going to the next day. So I love the fatigue, the spoons theory. So there you go.
Brilliant. No, I'm really glad that we got that in there because I love the way you described that, and I think it makes so much sense. Final tips for patients undergoing cancer treatment. You know, what would you like to be able to say to every person that has had a diagnosis of cancer?
Oh gosh, that's a difficult one, isn't it? The dental professionals are there to listen. They understand your journey. They will give you lots of hints and tips to keep not just your mouth healthy, but they're there to listen. And that's the biggest thing that I do, is I listen. And it may be about quality of life. Your life may change beyond what you thought. And it may not be as long as you thought. I don't know. You know, nobody knows these things. The science has moved on so much. But it's about good quality of life, and your dental professionals will definitely help you with your mouth and keep everything as healthy as possible, because it is all connected.
Great question.
Okay.
Deep breath. Children's cancers. What kind of advice or guidance can you give a parent of a child undergoing cancer therapy?
So there is actually a 7-year-old who comes to my practice. His grandmother brings him to the practice because she loves what I do. So you have to go back, I believe, to delivering better oral health and for your high-risk children. So then you're looking potentially at the percentage of the high fluoride toothpaste if they're over 10. If they're under 10, then definitely be looking at the different kinds of toothpaste that can help the mouths. We need some fluoride in there, whether it's going to the Oral Nurse toothpaste with no fluoride, no mint if they can't cope with mint and SLS, and definitely with the tooth mousse and the MI paste, things like that to sort of help the mouth. It's a very tricky one. It's a very tricky one about keeping their mouths clean, healthy, comfortable. Some patients are in and out of hospital constantly, you know, so yes, it's just being there, supporting and advising as best you can. Xylitol mint options. The 360-degree brush from Oraleave is a great brush if they can't manage a baby toothbrush. Just depends how the patient is and how they are feeling. So yeah.
And yeah, I think it's really important for those child patients to try and be caries-free, decay-free, and remain decay-free, which can be a big challenge. I know that I was involved visiting oncology patients in the Children's Hospital years ago. It was really hard. I mean, primarily they were asking me to basically tell parents and grandparents not to bring the children sweets.
Oh.
And that is a really tough one because as a parent, you feel absolutely useless. You want to be doing something to make this easier. So yeah, it's, you know, and many of these children that either are going to be, you know, it's not always terminal. So many of these children, they will recover or go into long periods of remission. So again, it's back to sort of don't forget about the mouse. In my mind, and I don't know whether you agree or not, but my mind is touching base with the oral team, the dental team, and make sure you keep touching base with them.
Absolutely.
I don't think there's a dental team that would not be accommodating.
I agree. Absolutely.
That might include the hospital dental services or the community dental services, but getting that appropriate advice that, you know, it's not just a general dental practice, that you have that option of getting that care. But that one, that just sprung to mind.
Yeah, no, absolutely. I agree.
Thank you very much indeed.
Thank you.
I could offer you a sweetie, but my doctor.
That's okay. Thank you very much.
Sugar-free with xylitol, so we're all right. But
it's all good.
Yeah, it's all good. But thank you ever so much, Jocelyn. I will keep you posted as how this goes on. Listen, take care. Thanks ever so much.
Thank you, Leigh.
Thanks, Jocelyn. Bye.
Yeah, bye.